Democratic Congressman Peter Welch of Vermont. Congressman, I want to address first off this idea that taxes will have to go up on more than just the wealthy. Do you buy that?
No, I don't. In fact, I think that we're spending way more on health care than we need to be. I mean, we're about 18% of the gross domestic product in health care. We still have 37 to 47 million folks without health care coverage. It's a huge drag on the balance sheet of our businesses.
How many, Congressman? When you say without health care, how many?
About 37 to 47 million Americans are without health care.
Well, that's a wide gap. I'm sorry. The reason why I want to fine-tune that, if it's 37 to 47 million, do you include illegals in that group?
No, I don't. And, you know, we don't want, I would rather not get diverted on the debate. The bill, as you know, makes it explicit that we're not going to cover illegal aliens. But bottom line here.
Well, by the way, it doesn't make it explicit in the House. They're working on that in the Senate. But you're right. I don't want to get diverted either. I do want to ask you about whether
the House bill I voted on does have it explicit, but go ahead.
Is this 3,200 we're talking around?
No, look, there's...
Okay, because I've looked at 3,200 and it doesn't. But you could be right.
Yes.
Now, here's what I want to raise with you. Is it fair to say that you have to be open to raising taxes beyond just the wealthy if even spending triggers that the president promises don't do enough?
That's not my view. It really isn't. You know, the president has said he won't sign this bill if it adds a dime to the deficit. And I'll tell you why. We spend more on health care than we should be. We have more waste in the system than we can afford. We really shouldn't be
How is the government going to make that efficient? When has it ever done?
Well, this is not about the government making efficient, but one of the things we're going to have to do is make certain that in this health care bill that you have real incentives to move from the fee-for-service volume-driven spending machine that we have in health care and move to value-based budgeting. And there's an immense amount of success stories around the country. But I want to get back to small business because that is of real concern. They are concerned about taxes, and they rightly should be. Small business is the backbone of our economy. Number one, 95% of the small businesses are exempt from this. Anything in the House bill with a payroll of less than $500,000 is exempt. But secondly, small businesses, many of them do provide health care benefits for their employees, but they're getting clobbered on 10, 15, 20% premium increases, and they're being put to this horrible choice.
I understand how everyone's suffering with these owners. Congressman, we're missing something here, and I might be as thick as a brick on this, but, you know, a lot of the savings you expect to be coming out of health care as a result of what you're proposing, if they don't get realized, you're going to have to get money from somewhere. And down the road, after these initial deficits and the savings you hope to experience, if they don't materialize, the president has already talked about these triggers to cut the spending. There is another option about expanding the tax base to pay for this. Are you saying that that would never, ever, ever be an option?
I'm saying that that's not a sustainable option.
Well, I know it's not sustainable. I'm asking you, is it an option if these hoped-for savings you're looking at don't materialize?
It's not an option as far as I'm concerned. If you are spending way more on health care than you should be, then you're not going to fix the system by spending more. Whether you raise it by taxes or just turn a blind eye. So you got to understand, I'd like you to understand anyway, there are a lot of us who are proponents of universal access to health care, having every citizen have the health care they need. But we believe that the only way we'll be successful in achieving that goal is with cost containment and better management.
And you believe the government could lead that effort, whether as a direct participant or as a key lead player, that this would be the first time, Congressman, this has ever happened. You believe this is the time?
No, there's a role, obviously, for government to play, but healthcare, by definition, is administered at the local level. I was on the board of a small hospital, and every month we were looking at the balance sheet, and every month we were looking at ways to try to be more efficient in our delivery of services. The government's got to be a partner, but at the local level, it's going to be the doctors and the hospitals and the others, the healthcare providers, that are going to be the ones who make this successful.
We shall see. Congressman, thank you very much. Good having you.